Hey, Dr. Dishman. Today we're going to be doing a video for functional mobility and ambulation aids. So first we're going to start by putting the gait belt on Nick. When you put the gait belt on a patient, you want to be sure that it's at their belly button as long as they have no gastrointestinal issues or any open wounds or wound vacs. So we're going to first put the gait belt on them, and then we're going to do bed mobility. We're going to go from supine to side lying to sitting. So you have the patient in supine, and first we're going to get them to side lying. So to do that, you're going to have the patient flex their knees, and you can help them as needed, but both their feet need to be flat on the bed. And then you're going to have them cross their arms over their chest. Their stronger arm, if they have a weaker side, their stronger arm wants to be on top so that they can push off with that arm. So to get them to side lying, if needed, the OT can help by just placing their hands behind the back of their scapula and the base of their hip. And so on 3, we're just going to twist you over to your side. 1, 2, 3. Okay, and then to get them to sitting position, the patient is going to use his strong arm to push off, and he can use his elbow to support himself, and at the same time, I'm going to help guide your legs to the floor. Ready? 1, 2, 3. Okay, so next we're going to be doing a sit to stand with a walker. So it's important that the walker is placed directly in front of the patient, and when the patient is standing in neutral position, the handles of the walker should be at their wrist. If it's a rollator, it should be locked into place, and you want to be sure that the patient is scooted close to the edge of their bed. And whenever you go to stand at your walker, it's important to educate your patients to always push up from where they're standing and get stable before they grab onto the walker. Never pull the walker close to you just because that increases fall risk. So go ahead and push off the bed to stand and then use your walker. Okay. So next we're going to be using our wheelchair to demonstrate the proper transfer from a wheelchair to your bed. So you want to be sure that the wheelchair is angled between 0 and 30 degrees to the bed, and as close to the bed or the transferring surface as possible. Before you transfer, your patient's going to be in the chair already, but just since it's small, I'll show you without him in it. You want to be sure that the footrests are off, the seatbelt is undone, and if needed, the arm rest can be taken off if possible. So go ahead and have a seat. So you have all of your add-ons taken off of the bed, and then again you're going to push off from your handles, and then we're just going to stand and pivot to the bed. Okay. Ready? Stand and sit. Okay, so next we're going to be using a walker for ambulation. So you want to be sure that the handles are at your wrist length, the neutral position. And then whenever you have your hands on the handles, that there's 15 to 30 degrees of elbow flexion. So go ahead, and whenever you use your walker, you're going to move the walker 6 to 8 inches first, and then your affected or weaker side comes up first, and then your unaffected side comes 6 to 8 inches with the walker, affected side, and then your unaffected side. So you want to try that? And it's important to tell the patient too, as he's picking up the walker, he's not dragging it. Next, we're going to do a 3-point gait with a cane. So you want a cane, one that can be adjusted to be at your wrist height, again, where the handle is, and then you'll have 15 to 30 degrees of elbow flexion whenever you're holding onto it. Whenever you walk with the cane, it's most common that you're going to use the cane on your stronger side, because you're going to bear about 30% weight through the cane. So your stronger side and the cane move at the same time, followed by your affected side, and every time you move the cane, it's going to move 6 to 10 inches. So move the cane and your right side, your strong side at the same time, followed by your affected side. Okay. So the next one we're going to do is a 2-point gait with your crutches. So whenever you're instructing a patient who is new to crutches, you want to adjust them to where when they're standing with their crutches, you can have about 2 to 3 fingers in between the crutch and the armpit. Whenever your arms are hanging naturally, the handle should be at wrist height, and then whenever you're holding onto the crutch, you should have about 15 to 30 degrees of elbow flexion. Also, it's important to educate your patients that whenever they're using their crutches, before they take them out for the day, that they check the rubber pads at the bottom that they're in place, and that these buckles are locked into place and stabilized so that they won't move. And it's also important to know that you should never support your body weight and just have hanging weight on your crutches, because that could cause axillary blood vessel damage. So for the 2-point gait, whenever you do this, it is a contralateral step-through movement. It's for patients who have enough stability and mobility to still have a natural gait pattern. So whenever you do the 2-point step, you're moving contralaterally, so your right crutch and your left foot are going to move at the same time, and then your left crutch and your right foot at the same time. So there's 2 contralateral sides moving together at the same time. Do is a 3-point gait with crutches. This one is probably the most common. It is for patients who do have non-weight bearing restrictions. So you're going to move your crutches 6 to 10 inches at a time. Both crutches are going to move at the same time. Your affected leg is probably going to be up in a cast or a boot. And then as your crutches move 6 to 10 inches in front of you, your strong leg is going to move to the line of the crutches. As the patient gets better at this, they can start to kind of swing their leg through the line of the crutches. So both crutches at once, and then your strong leg moves to them. Keep going. And then eventually your strong leg moves through the crutches. The next one we'll do is a 4-point gait with your crutches. So this one provides maximum stability. It is the slower rate of movement, but it provides max assist for patients who have had bilateral instability or bilateral weakness. So whenever you do this one, it's max assist because there's 3 points of contact to the floor at all times. So you move your right crutch, and then your left leg, and then your left crutch, and then your right leg, and then continued on. So you're going to show that one.